All righty. We are going to be working on the chapter 11 in Essential Science. And the content in this chapter is going to support information that you will be learning about in chapter 12 in Fundamentals of Therapeutic Massage, specifically around adapting massage to support fluid movement in the lymphatic and cardiovascular systems, as well as how that might support immunity. So this final unit, rest of the body systems, is 2 chapters, 4 body systems per chapter. These are areas that certainly are important to understand. However, the direct access we have to making physiological changes or stimulating physiological function or touching the anatomy in these chapters is much less defined, much less intense with all of this. And so as we work with these, the material has been pre-selected, unlike a generalized anatomy and physiology book, to content that's most relevant to massage therapy practice in general. So you can look at a more comprehensive generalized textbook. Thibodeau and Patton that Elsevier has is really good. Or you can compare this to some other textbook versions of anatomy and physiology, and you will see that the content is much less for these next 8 body systems than what we have discussed previously, which have more direct impact on the practice of massage therapy. So let's share the screen and get to the chapter. So chapter 11 has the integumentary, that's the skin, mucous membranes, cardiovascular, lymphatic, and immune systems. And chapter 12 has respiratory, digestive, urinary, and reproductive. And the content is targeted in these chapters to develop a platform for methods that might specifically address these areas in massage to support the mimic normal or support normal. So if you look at the videos from chapter 12 in fundamentals, you'll see that specifically in relationship to the lymphatic and cardiovascular system. Chapter 12 in your Essential Science book, the respiratory and digestive systems are the areas that we can have the most direct influence on. And so you'll find that there's a little bit more information about these 2 systems than there is about the urinary system. Okay, so let's open this up. And we're going to target on a variety of study guidelines. And I just want to remind everybody that there are guest speaker YouTubes for each of these systems as well. And the links are found on Canvas. And you can even delve into this more by continuing to investigate these. And with the science material, the language part of it and the functional capacity of it, repetition, 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 and the more you hear it in different ways, the better. There are also a lot of videos that are directly connected with this textbook series, and the link is on Canvas for you. And that same link to all of those videos from Elsevier is found in the Fundamentals textbook as well. All right. So each of these is going to follow the same kind of format. We're going to have an overview, and then we're going to have structures and or function, and then pathology. And that's going to be like that all the way through. Okay, so chapter objectives overall, key terms with the pronunciation, and learning how to learn. So these systems, these 8 body systems in this unit, chances are with the MBLEX exam, you're going to get your most questions related to the circulatory system, lymphatic system, respiratory system, and digestive system. And so you'll want to put most of your energy in working with those. It doesn't mean that the other body systems aren't important, and they all work together. Every one of them, you can't separate them. So we're an organism that functions as a complex, symbiotic, coordinated unit. And so to even study these separately is artificial. And that sometimes can happen when we start to specialize, is that an area of specialization is sometimes massage specializes with additional training on the lymphatic system. And that starts to narrow your focus. There's some real value in being a generalist and then knowing how to refer to a specialist if it's needed. So the language and the pathology and the understanding of how massage might interface with the pathology seems to be the learning curve necessary to really absorb the information in these chapters. So these bullet points right here give you some idea of the relationship with specialization. So for example, if you wanted to work with cosmetic surgeons that are doing facelifts or reconstruction, breast augmentation or whatever, you're going to need to know more about the integumentary system. If you were wanting to target pre and postnatal, you're going to have to know more about the reproductive system. So this then becomes advanced learning. So there's no prenatal massage. There is massage adapted with additional knowledge about the reproductive system and birth. And so when you take a specialized class in this, most of it should be increased knowledge about the anatomy and physiological function so that you can make better clinical decisions as you decide how you're going to adapt. So there's a chapter in Fundamentals, chapter 14, that specifically looks at adapting massage and also a focus on specialization based on a population. And then this can give you some idea about where the learning curve comes in. So the integumentary system is our skin. It's an amazing organ. It truly is our separation between our internal and external world. There are tons of sensory listening stations, sensory receptors in the skin and superficial fascia. It is what we touch over and over and over and over. And if we actually attempt to touch another structure underneath the skin, then it's always indirectly. The skin is what we can touch directly. So we need to know a little bit about it. And what is the physical nature of the skin? And what is the layering of it? It's a fast turning over system. The cells here turn over very quick. So we get a lot of replacement of the skin. And again, this is some of these receptors that are in here. If we didn't do anything but stimulate the skin, we would have massage therapy benefit. And there are some people that say that that's all that does happen. I happen to think it's more than that, but I don't want to discount the importance of the sensory input from massage therapy, introduction of mechanical forces, and how that is processed through the nervous system. And the skin's organized in a variety of ways. And these are called, I think, Langer lines, cleavage lines. Now, if you took this figure and compared it to the figure in chapter 12 related to the direction of the strokes for connective tissue massage, a system of connective tissue massage, you would see they line up, which is pretty cool. That system is to work along these cleavage lines. Now, just in the last few years, there was this big issue around discovering a new organ, and it was called the Interstitium. There's still discussion about, is it part of the skin and superficial fascia, or is it something separate itself, or what? But it goes to show you that new things can be discovered as the technology can see smaller and smaller things. And this was actually discovered by using microscopic enhancement of tissue over live tissue, where these little pockets of fluid were present and how that fluid moved through these tubules. And when an actual slide of this is taken where the tissue is removed from the body, these pockets are cut, and so the fluid seeps out of them, and then the little pockets collapse, and so it looks like a totally different tissue. So everybody was very excited about this, and they started to speculate on, well, is this the, part of the electrical system, or is this, the interconnection of mechanotransduction and connective tissue work, and the issue is it's always been there. Just because we just were able to find it with a different technology doesn't mean it hasn't always been there, and it's close enough to the surface that loading it with mechanical forces is going to squish it around somehow, and so it's going to change its shape, and it's going to move it. And because there are sensory receptors everywhere, then there's going to have some sort of an effect. Now, during massage, we're always assessing, right? And the appendages of the skin, the hair, the nails, how well lubricated the skin is, what's the moisture content, or is it dry? That's where your sebaceous oil glands come in. This tissue can give you a lot of information about the general health status of a client. For instance, when I'm massaging the scalp, if I notice that I'm getting a lot of hair falling out, or I notice that on the pillowcase, that's gonna make me stop and wonder what's going on. Same with the nails, or if the cuticle structure around the nails is not healing very well, if it's been, there's been a hangnail, or if the nails are really rough. There are pathologies that show up in these external or these appendages of the skin. Sweat glands there's two kinds, apocrine and eccrine. But if there's a lack of sweating or excessive sweating, the generalized pathology, too much or not enough, or if there is an odor, an increased odor or a change in the odor, that would make me wonder if there's something going on within the attempt of the body to maintain homeostasis. Now, the mammary gland, the breast is actually part of the skin. We think of it as part of the reproductive system, and it does produce milk, but it is actually classified in the integumentary. And then there's the variations in skin color, and that also can be indicative of a shift in homeostasis. And, is the warmth also can be part of this too, to indicate if there's circulation or lack of circulation, or various genetic predispositions related to race, exposure to the sun, adaptive capacity. That can also show up in the amount of melanin. Albinism is where there's some lack of pigment with the skin, but it also affects lots of body systems. So we want to pay attention. We want to look for the health of the integument in general, including the appendages. And we want to keep track of that from session to session to session. We also have the ability to heal on a skin level. The skin turns over quite quickly. There are a lot of stem cells, undifferentiated cells in the area. And there's a progression of how a wound, a break in the skin, will heal itself, and how much of that will be productive integumentary tissue as opposed to scar tissue, which certainly closes the hole and brings back the integrity, but is not as functioning. And there are a lot of conditions that show up on the skin. And these conditions can be contagious or not. And so we have to have some sort of an idea with it. But the thing we watch with the skin, if there's anything that has breached through the skin, a puncturoma, a insect bite, a scrape, a cut, a surgical incision, now that is a venue or a pathway for bacteria to get in. And so these are a variety of bacterial infections that can occur. And then we also have viral skin infections. And viruses often, when they become active, erupt onto the skin. Chickenpox, herpes simplex 1 and 2, and then they'll sometimes go run back and hide someplace and then show up again. And these viral infections can be really contagious, as can the bacterial infections. Because staph is very common, various staph infections. So here's a figure that gives you some examples of common skin conditions. We do want to be very attentive to looking at the changes that can occur in the skin related to malignancies. And so that's explained here further on. Warts are viral, therefore contagious. Contact dermatitis usually is a hypersensitivity to some sort of a product that has some sort of a irritant in it to the skin. So here's an example of somebody having a skin eruption related to using an ointment, lidocaine here. This is a boil. Herpes zoster is shingles. That's a viral eruption secondary to chickenpox, and it can be very painful. This is a bacterial infection. This is another form of cancer. Eczema is typically not contagious, nor does it have a pathogen involved with it. It's autoimmune at the skin level, and the skin either breaks down or it turns over too quickly. And there's an autoimmune condition called psoriasis where this also can occur. And well, there's the psoriasis. And the problem is, if this fast turnover or this breakdown of the skin occurs, then that natural barrier that we have is compromised, and infection, pathogens can get in. Scabies is a parasite. It's a little mite, and it's highly, highly contagious. And it usually is found in the groin area, but it can occur anywhere in the body. And it's treatable, but because of the contagious nature of it and the spread of it, you want to be really aware. And it would be a question that you may need to ask. This is a squamous cell carcinoma. You can see the uneven edges around it, which is one of the signs. This is ringworm. This is a fungus, and it is also contagious. And then this is vitiligo. This has to do with the pigmentation of the skin. This is not contagious. And it shows up on all types of people, cultures, races. It's just more visible on darker skin. So measles is a viral infection that erupts onto the skin. This is a more superficial hair follicle. Clogging up of the pore area. Warts we talked about. Here are your fungal infections. Here are your parasitic infections, lice, scabies. And then we have where the skin is rubbed, and the surface of the skin wears down, and the deeper layers of the skin become exposed. These can be very painful, and they most often occur in areas where people do not move very well, and they're sitting in one area for a long period of time or laying in one area for a period of time. Then we have various growths. We tend to, the older we get, the more of these kind of growths we have. These are benign. You do have to watch a mole, nevus, because it can have a tendency to move from benign to malignant. So you want to make sure that there's no change in the size or shape, or that it changes color, or is bleeding. You know, those would be all indications for referral. A lipoma is an accumulation of fat cells that is in the superficial layers, and it's a lumpy, bumpy thing. If they're problematic, they get in the way, or they're rubbing on something, they can be fairly easily removed. A sebaceous cyst is part of the within the opening of the hair follicle that has all of the sebum, which is the material that lubricates, and it's a waxy. And if the normal movement of that onto the skin gets interrupted or clogged up, then that can continue to accumulate. It's a similar process with some types of what we'd call acne, but acne can also, these pores can get a bacterial infection in them as well. A skin tag, just for some reason, it just grows out, more common in the elderly. These can be pretty easily snipped off. Now, an angioma is usually it's presented at birth, and then many times they'll disappear, but sometimes they don't. They can be a real mass and tangle of vessels in there, and there's a tendency for them to bleed easily. So if they're in areas where they get bumped or rubbed, that can be problematic. They can be quite disfiguring if they're on the face. And so if you have a client that has an angioma, don't massage heavy over it because of the fragility of the capillary structure and the vessel structure in there. And then we have our malignancies, our malignant skin conditions, and some of these are very easily treated. Basal cell carcinoma, squamous cell carcinoma, those are, especially if caught early, they can be treated fairly successfully. But melanoma is very dangerous, and it can show up even in areas that you don't expect, like under the nails or whatever. And so you don't necessarily, I don't have the expertise to differentiate between these. So if there is a change in the skin, and you know, you're starting to see things that look like these pictures here, then it's a referral, so that you can really make sure of what's going on with stuff. The contagious nature of skin conditions, sanitation procedures that you should always be using would be protective. Possibly you would want to glove up. These are contact spread. And then we have breast disorders here as well. So fibrocystic disease or fibrotic breast tissues, that's fairly common. And it can feel lumpy, which can be a concern because you don't know if it is fibrotic tissue or not. So that's always an indication for a referral. And then there's breast cancer, which they have been working very hard to treat, and they've been making some really good progression on that. Breast cancer has a tendency to metastasize, so it goes to other parts of the body and takes up residence and starts invading other tissues. It can also be hormonally dependent, and men can get breast cancer too. So, and we might then be dealing with issues related to the treatment of the breast cancer or any of the other malignancies. Usually there could be a chemical burn to it, there could be radiation, there could be chemotherapy, specifically targets fast dividing cells, and that's what the integument is, including the mucous membranes, and so it's going to it's going to compromise the skin. So we do have to slow down and think more around cautions and gather more information if we have a client with these issues. Burns are rough. So if it's a first degree burn, it's probably going to take care of itself. A second degree burn has a tendency to blister. These are local contraindications. But as they get worse and we get into third degree burns, you're getting into the deeper layers of the skin, maybe even burned down deep enough into the superficial fascia. These are very serious. And there are a couple of studies that have shown that as the burn area is healing, not in the acute phase, but later on, it's really scratchy. It's got a lot of itching to it. And massage has had a tendency to reduce that sensation, which is very annoying. This is very painful. I've worked with people that have had significant burns, mostly a year or two or three or four after the burns. And one of the things they would say to me, because this is scar tissue now that heals these pretty decent second degree burns and into the third degree burns, it just felt to them like their skin was looser for a while after the massage. And that's pretty valuable. So I have not experienced burns myself, but I do really appreciate what the various clients I've had over the years had to deal with, both in the active healing aspect of the burn and the trauma around the event that caused the burn and the result of having the skin so damaged. Things that you might not even think of, such as interference with the ability to sweat. So if you have a passion for dealing with an individual who has significant burn scarring. You may want to certainly learn more about how burns occur and what the healing process is, the various treatments that go along with that. And you probably aren't going to work with them during the acute healing. What you may find yourself doing if there's extensive burns, maybe there isn't a burn on the foot or the hand. And so maybe you can provide massage there that will be part of comfort care and maybe reduce the anxiety. But you're not going to massage directly over a burn until it's through a significant part of the healing process. So here are some other non-contagious conditions. This is hives. Alopecia is where you lose the hair. Scleroderma can be problematic. It's actually an autonomic condition related to the connective tissue. And so we think of it as the skin getting stiff, but it also affects other organs. And so this can become progressive. I have worked with people with scleroderma, and again, just like with the burn, the clients with the burns, they said that their skin felt looser for a while. And again, that's valuable. And then vitiligo, which we already talked about. So in general, there are indications for massage therapy that would more specifically target the skin, and we can't not touch the skin. Even if we're working through clothes, right underneath the clothing is the skin. So it's worthwhile having appreciation for this structure, and then cautions that need to be taken if there is pathology or injury to the skin. Here's your little section summary, and ta-da. So that's the skin. We're going to continue on with the cardiovascular system, but you would want to stop here, look at all the videos, and maybe do some of your own research about the skin and absorb more information about that. Remember, the intent of these videos is to lead you through a study strategy with the textbook. So we're going to find the exact same layout here on the cardiovascular system. Now, some of these structures are close enough that we may be able to have a direct effect. Some of them are responsive to changes in the neurochemical response. So like if we rub the skin and it gets red, that's a histamine response, which is a vasodilator, which is going to increase the diameter of these vessels so they can get bigger. But more than likely, and this is talked about again in chapter 12 on the section in chapter 12 in fundamentals on how we adapt massage to fluid movement here. You're going to hear it in the next piece with the lymphatic system. Maybe we are having a mechanical effect on the movement of the fluid. If we understand how these work in a normal function, then we can mimic normal. And if we understand how these systems break down, then maybe we can be supportive. So just a little word of caution here on how you need to frame the direct influence of massage. Now, the cardiovascular system, if something goes wrong there, it can go wrong fast and bad. So this is an area that we need to be screening for. We need to make sure that we're getting a good history on this with people. And when in doubt, refer. You know, I lived this with a major blockage in the left main, and I chalked off the ambiguous symptoms to other things. And if it wasn't the persistence of my general practitioner, that she had a feeling that it was cardiovascular, I probably would have ignored it and wouldn't be making all of these videos for you. But it was very hard to diagnose too. And even an interventional cardiologist couldn't find it. Cardiac stuff does that. So that's an example of a blockage in a coronary artery. We also can have blockages in the peripheral arteries. So that's peripheral artery disease, and that can manifest as aching legs. So we do have to always think beyond the observable tissue and the common things we think are going on with massage, and slow down and be more careful here in terms of symptoms and referrals. Okay, so here's the focus on professionalism. This is talking about quality of evidence here and best practices. And then here's our pump. The heart is the pump. There are lots of really good videos here on the whole cardiac cycle. And you know, you generally need to know the progression, the main structures of the heart and the flow of the blood through the heart. There may be a question on a valve. Personally, I wish they didn't have a lot of precision structure-based questions on the cardiovascular system, but those may show up on the MBLEX. The cardiovascular system has lots of parts. When you think of all of the heart and all of its parts, and then all the arteries and the arterioles and the capillaries and the venues and the veins, and you know, it's got a lot of parts. So that's what we're talking about here. And you know, blood pressure is we're talking a little bit about blood pressure. Blood pressure is a common indicator that something is wrong with the cardiovascular system, either high or low. Blood pressure has been used a lot, and heart variability rate have been used a lot as measurements on the effects of massage, primarily based on the autonomic nervous system. So we need to understand what this is. We need to know how the heart, the electrical system of the heart functions. And that can go a little haywire. And sometimes people have to have a procedure called an ablation to make sure that some of these overactive electrical cells in the heart aren't causing an irregular heartbeat. This shows in general the structure and closed unit of the circulatory system, and it's here at the capillaries that we get the exchange. This is where the plasma type material seeps out and gets into the interstitial, the spaces around the cells. You're going to want to have a general idea of the types of arteries and the location of the major arteries. You're going to learn for supporting arterial flow you use compression to essentially crimp the hose, crimp the artery, and you get a pressure head between the heart and where you have crimped that, and potentially a little bit more flow. I think it's minor, but that's a mimic normal on that. I think general massage just does it. The capillaries are everywhere because that's where you have your exchange of nutrient and waste product, and that's it's really, I often think about that as a sponge almost. So these pictures here are giving you some of the main structures of the cardiovascular system. You should have a working knowledge of these terms. And here's a picture, is this a practical? Yeah, of using kneading and compressing to kind of squeeze the capillary beds, which can have, at least for a little bit of a time, a influence on exchange of fluid at a very local level. So here's the veins. You should have a working knowledge of the terminology here. And then the method that the venous blood gets back towards the heart, and the calf, for example, is a secondary pump. As you walk, those muscles contract and relax. They broaden and lengthen against these main return arteries in the lower limb. The breathing as well is a big support for movement of venous blood back to the heart. And if we're going to think about how we would encourage blood flow, then this gives us the idea of the direction, our intention for which way we're wanting the blood to move, the fluid to move. I check pulses a lot, and I compare one side to the other, and I want them to be fairly even. If there's enough of a discrepancy that I can feel that, then that would be to me, that's an indication for a referral. Something is going on with the distribution of the blood. So you're going to want to have a pretty good idea where these main pulse points are and be able to feel those. And it's real easy to do a quick pulse check. It looks like a hold, and you want to make sure that you've got, like I say, some even flow, some symmetry in these areas. So blood pressure is often called the silent killer, and it's highly regulated by the endocrine system, the nervous system, and blood volume in and of itself. And so you're going to want to have a good idea of the statistics, the main identifiers, like what's normal blood pressure and that sort of thing. So that's this box. And then there's a series of receptors that can raise and lower blood pressure. And one of them is here in the neck. And sometimes people can have a drop in blood pressure if you massage on the anterior part of the neck here in front of the sternocleidomastoid. mean, they will use that as an emergency reflex to lower blood pressure if it's too high. But people can get kind of dizzy and out of it if you're pressing in there. And that's why under most circumstances, I won't have you massage in the anterior triangle right here. It's one of the reasons. And then there's major vessels in this area as well. So this listing in through here are the names of the major arteries that you should have working knowledge of, and same with the veins. Compare them, go find them on those pictures. And a general working knowledge of the various constituents of the blood, red blood cells, white blood cells, the different kinds, what do platelets do, what's the importance of plasma. Do watch the supportive videos that we have for this. And then here are your pathological conditions. And not all, but a lot of our vital signs that are taken to determine what's going on with homeostasis has to do with the cardiovascular system. So you can have slow heart rate, fast heart rate, irregular heart rate. You can have dysfunction with the valves. And all of these, the person's just going to feel not very good. And so if they're just saying, I kind of don't feel very good, there's a condition called mitral valve prolapse that also often goes misdiagnosed or undiagnosed. But if your heart rate's too slow or your heart rate's too fast, or if it's irregular and up and down all the time, that's going to make you feel like something's not right. A pain in the chest, angina. Now I mistook that for just some tightness in my chest, and I was working a lot. I was doing a lot of massage. I was carrying my table a lot. So when I had this in 2007, so you know, I mistook this for something else. So some of this is not as clear cut as you might think. A heart attack is when there is one or more of the coronary arteries are not delivering enough blood. Those are the arteries that feed the heart. Now, I did not have a heart attack. I was very fortunate. Why not? Who knows? So I could be here and continue to teach something. Because it was a serious blockage in the left main. So that feeds 2/3 of the heart. And I can look back on it and I can see it. But people don't always notice this. And sometimes we will notice these as massage therapists. And we don't say, oh, I think you're going to have a heart attack, or, you know, but having a general awareness of the vague, some of these symptoms are very vague, and saying, when was the last time you had a good physical? You know, it would be good to have this stuff checked out and make sure that this kind of off feeling that you're having is not something to do with cardiac function or blood flow or an endocrine problem or whatever. So we become an observer that says to our clients, you're a little different than you were. That has drawn my attention, and I have no clue what it is, just that you act different, you look different, you feel a little different. And I strongly suggest you have a good physical. So one of the signs that you will see with congestive heart failure when the heart is not pumping very well is you'll see it swelling both congestion and edema in the lower limbs of your client. And you can go ahead and do massage, but you want to be aware that the body is compromised in the ability to move this fluid around. You can also get infections of the heart, and there can be persistent inflammation in there. Then we have disorders that are more related to the tubes. So we've got arterial sclerosis and atherosclerosis here. Here's your heart attack signs or your cardiovascular stuff. I had this one a little, but I was able to attribute it to other things. So, you know, probably not the wisest thing in the world. So pay attention here. Better it's caught. Better somebody says, you know, I'm kind of having this thing. And you say, that could be, here, look at this picture. That could be indication that something might be going on with your heart. You should go have it checked. And if you catch it early, or you catch it before it gets really bad, or you're lucky like I was, then a person won't have significant damage or die from this. So sometimes I think we don't do our job on referral enough. Now, you don't want to scare somebody to death, but a picture like this can be helpful. So here's your warning signs. And more information on coronary artery disease. And this is a schematic on congestive heart failure. There's right-sided and left-sided. I've never seen or heard of a question on the Emblex exam specific to whether it's right-sided or left-sided congestive heart failure. But because of the serious nature of a cardiac issue, you will find questions on the Emblex about this so that you can make good decisions about referrals or adapting of the massage. So this schematic right here has to do with clogging of the artery, atherosclerosis, and arterial sclerosis. And we're not going to do anything specific for massage for this. In fact, what we could do is a person might feel a little better after the massage, and they may ignore these symptoms that are trying to alert them to something's going on. Usually there's an alert phase. I did remember, I think, having a temporary occlusion where I got real spacey and felt really wrong. And then it apparently cleared itself. So another very fortunate situation for me. But you don't want to take a risk here on these sorts of things. The issue with varicoses or varicose veins is that the blood moves slow and can fall back, and it can develop a clot or a thrombus, and that can move through and block off an artery or get into the lungs and cause a problem. And so we do have to be cautious of this clotting and like a deep vein thrombosis. Shock is when there is not enough blood going to the organs. And that could, it's likely not going to happen during massage, but it might be secondary to something else, like an allergic reaction, or a real shift in blood sugar for somebody who's got low blood sugar or diabetes. Inflammation in general is a big underlying cause of a lot of cardiovascular issues. So, interestingly, massage in general has been shown to help normalize this persistent chronic inflammation that's not doing any good. So, but there's no specific kind of massage. It has to do with something to do with the pressing, the compression of the tissues. Raynaud's is more of an autonomic situation where you're not controlling your vasoconstriction and vasodilation. It can be very stress triggered. Anemia, that's not enough red blood cells. You can have inflammation in the arteries, phlebitis, or in the veins, I mean. You can have an embolism, which is more in the heart, in the lungs. And these are areas that these things can occur. So common sites for a clot, trying to come up with an example. The blood gets thick and it acts like a big plug. And so we want to be careful of that. There are also conditions where the blood will not clot, or that there's just too much blood being expelled. And so that would be a hemorrhage. And one of the major serious events post-birth is that where the placenta was attached to the uterus, when it pulls away, that blood doesn't, those clotting factors are not there or not fast enough, and there's hemorrhage. That used to be a major reason for women dying in childbirth, and still is. Sickle cell disease is a genetic trait. It's quite painful, and the client will know if they have it. It is not something that you are going to directly influence, but indirectly, you may be able to have be soothing, especially if they're having a pain, some pain associated with it. You can have a sickle cell crisis, and that's a medical emergency. Here are your various embolisms. It is the clot, the thrombus, the embolism. It sort of sometimes is where it's at on what these words are interchangeable. So these are some other blood disorders that you'll want to have some working knowledge around, because it may influence the type of pressure you have with a client, especially if it's interfering with clotting. And there can be medications that you can take that also can interfere with clotting. So we don't want to move a clot, but clotting is important. So if the blood is, something is altering the ability to clot, then we could have hemorrhage or excessive bleeding. And then here are your indications and contraindications, which I have been talking about. and a summary here for you. So we're going to stop this video and then we'll pick it back up with the lymphatic system. And both the circulatory system and the cardiovascular system we talked about also in relationship to methodology in chapter 12 in fundamentals. So, all righty, let's end this video. So, you do have to have enough information about how the circulatory system works so that you don't ignore a sign or a symptom and the person does not get a referral or it isn't brought to their attention. And you don't want to say, oh, is this, you know, person says, is this a heart attack? Is this a heart attack? You don't have you don't have the experience and the training to say, no, it is not. Now, many times there'll be other things, musculoskeletal or nerve impingement that are mimicking these sensations, or a panic attack, anxiety, but you don't know that. So it needs to be referred, it needs to be attended to. And then if it comes back and it's these other things, then we can alter our treatment plan to see if there's something we can do to help the person function better. This is the way this is going to go in all of these body systems in these two chapters. There's a general overview and then enough understanding so that you have the right kind of awareness that you know how to adapt and refer. Okay.